Hello, I'm Dr. Barry Pecos, York Region's Medical Officer of Health. It's hard to believe, but we are approaching the 3-year anniversary of the World Health Organization's declaration of the COVID-19 global pandemic on March 11th, 2020. Fortunately and finally, it does seem that we are turning a corner. While the impact of COVID-19 is very much with us and impacting acute care, our physical and mental health, and our ability to recover, things are much closer to normal than they have ever been. Our hospitalization numbers are decreasing, our wastewater burden is decreasing, and our outbreaks in facilities are lower than they've been in many years. Previously, to get to these low levels of COVID-19's impact, we needed severe pandemic control measures. But this time, we've achieved this with overwhelming population immunity from vaccination and several waves of very transmissible variants. So what do we still need to do? People are still dying of COVID-19 unnecessarily, and we still need to protect the most vulnerable among us from illness, as we would with any other infection. It is still important to take appropriate precautions like staying home when symptomatic, wearing a mask around vulnerable individuals in crowded spaces, and washing your hands frequently. This will minimize the risk of COVID-19 in the most vulnerable and help keep us in a good place, COVID-19 wise and relating to other infections. Of course, our success and each and every person's good health remains due in a very large measure to vaccination. The bivalent vaccine protects from severe illness and hospitalization for you and your loved ones. We have had excellent uptake with our over 70 population, but those over 60 and even those over 50 who are still somewhat at risk remain less protected than they need to be. Everyone over 5 years of age is eligible for the bivalent vaccine, and those who are older should have received a bivalent vaccine, especially if you haven't had a dose or COVID-19 infection in the last 6 months. We know that immunity wanes over time, and a booster now should bring you and all of us through to the fall. You can get your vaccine by walking into a York Region Public Health Clinic or by booking ahead at york.ca/COVID-19 vaccine or by calling Access York at 1-877-464-9675. Over the last 3 years, healthcare, public health, and our lives have been immeasurably disrupted. These actions saved lives. Thousands, tens of thousands, hundreds of thousands of lives across Canada. But one of the consequences of these measures was that they moved our focus away from other important preventive health actions and made us vulnerable to other illnesses. One of the very important impacts of the pandemic was the disruption of our usual vaccination efforts. As you will know, there have been measles cases now detected in Ontario and many cases globally. Measles is a very, very infectious virus that can kill and disable children, and it is very vaccine preventable. It was eliminated from Canada only 25 years ago, and we can't allow it to return. The last thing we need now are more outbreaks and illnesses. So what we each need to do now is ensure that everyone is protected through our regular vaccine schedule. If you're a caregiver and not sure if your child is protected, please visit your doctor and don't forget to report those vaccinations to us so we can add them to your child's record. York Region Public Health is working hard to ensure that not only is each individual protected, but the community is protected. One of the things that was disrupted during the pandemic were our critical vaccinations like HPV vaccine, hepatitis B, and meningococcal vaccines that are delivered in schools through our grade 7 program. We have been back in the schools already this year and are looking to catch everyone up on these vaccines that prevent cervical cancer, severe liver disease, and meningitis. If any of these important vaccines have been missed, students can now catch up on them at York Region Public Health Community Immunization Clinics. I'm excited to share that we will have a March break clinic to deliver those clinics and routine immunizations. For more information about available immunizations or to book an appointment, you can visit york.ca/immunization. Let's continue to work together to prioritize health and prevent illness, whether it's COVID-19 or other infections or conditions. I look forward to sharing future good news regarding COVID-19 and other important health protection and health promotion efforts with you.